like to call it the Etobicoke Lakeshore Podcast, and that's because, well, that's the name of the podcast, actually. Hi, I'm Mike. There's Roger Tumanieri.
Hello.
He publishes a lovely digest-sized magazine, just perfectly made for the Etobicoke Lakeshore area. It's called Etobicoke Lakeshore Press, and that is why we podcast under the same name. How have you been, buddy?
Excellent, thank you. How are you today?
I'm good. I am enjoying making a podcast with you every week. The people that you bring in are fascinating.
Oh, yes. Are you cleaning your hands every day?
It's so funny. Today, twice so far before the show even started, because today's guest is a physician.
Yes.
And I noticed he washed his hands, and I immediately panicked and pushed him out of the way at the sink. Move! I need to wash my hands.
I felt like I had to wash mine too.
Yeah, by the time this podcast comes out, we might be, because it'll be probably a couple weeks down the road. We like to record a couple at a time when we can. But maybe the coronavirus situation will completely have vanished from our thoughts.
Let's hope so.
But I have a feeling it won't. And
probably
so today
not.
We might be a primer, sort of an update. And
absolutely.
An interesting perspective. So stay with us. We have a doctor in the house. I'll encourage you, if I may, to subscribe to the podcast. It's everywhere you listen to podcasts, Spotify and iTunes, and for goodness sake, you'll even find it at etobicoke-lakeshorepress.com. But subscribe to it wherever you listen, because if you want to find out more about the South Etobicoke, Mimico Lakeshore area, which is very beautiful and a lot of fun, stay with us. You're part of the neighborhood. And we would encourage you to reach out if there's any reason to do so, such as being in the magazine, or you've noticed something in the neighborhood you think we should spotlight. Roger, where can people reach out?
Absolutely. They can find me online at etobicoke-lakeshorepress.com, or they can send me an email at etobicoke-lakeshorepress@gmail.com.
You the man. Okay, let's play the game where we flip through the mag and I quiz you on what I found in it. It's kind of fun. It's something my kids and I like to play around the holidays. I made that up. Here we go. I'm flipping.
Flip it.
And we stop right here at a very interesting... I've seen this face before in the neighborhood for sure, maybe even associated with the magazine. Tell me a little bit, if you will, about Kelly Farrell.
Oh, yes, Kelly.
She's a feature, and you'll find her on page 24 of this month's edition.
That's right. We featured her in our March edition, which is celebrating women entrepreneurs. And she started an alternative school in Mimico called Oak Learners. It's right on Royal York, and she's doing some great things there. I encourage everyone to read her feature, which again is on page 24 of the March edition. And you can find that on our website. The current edition is on the homepage, fresh off the press, at etobicoke-lakeshorepress.com. It's
interesting because it seems like this was a passion project for her to begin with. All the things that she loved the most in life culminated in creating school.
And I think that's the best way to start a business. I think she saw a gap in the education system, and she wanted to fill it. And she's well skilled, and I think she's doing great things for the community in Mimico.
Okay, I'm flipping. Don't even stop me. Don't even try.
Stop.
Okay, nice work. You did stop me. Who have I got here? Hey, do you remember a WKRP in Cincinnati?
I do.
Okay.
I do.
Do you remember they had a client?
I used to watch that all the time.
It was so great, right? Remember they had Ferryman's funeral home on there, and the guy was such a stiff character. He was, but as I flip to this page, I stop on Brad Jones, who is the antithesis of that guy that I envisioned from.
He's not stiff at all.
The old school funeral director. As I stop here, I think this is one of the friendliest faces I have ever seen in my life, and also a feature writer in the magazine, but he's a funeral director. Tell us about Brad.
Brad's a cool cat, man. He's really laid back, super professional. He's a nice human being. He is the funeral director at Ridley Funeral Home on Lakeshore, and he writes about death, and it sounds weird to talk about on here. It's kind of an odd thing to publish. Sounds like a dark theme, but really he writes from a perspective of light, and I think it really comforts readers who are grieving. In fact, through him we get the most feedback from the magazine. People love his articles. They're called Life's Undertakings.
What a great title for his article. I love it.
Yeah. And he just does such a great job. He gets tons of feedback from readers, and it makes me feel good that I can publish content that helps readers feel good in some capacity. It helps them get through some rough times. And Brad just does such a wonderful job.
We are so far away from the Victorian era of dealing with the inevitable, that dealing with it in communication and expertise in the funeral industry, that's what's now required, is to be part of that grieving process and an expert in the process. It's an interesting perspective to have.
Yeah.
Very, very cool. All right. The magazine is out. You can check it out. Where do people pick it up?
You can pick it up at the Long Branch Go Station, San Remo Bakery.
You didn't tell me about the Long Branch station.
I put it in all kinds of places. I can't give all the locations
Right.
out on one podcast. It'd be too long.
Okay.
But well, how about we talk about where you can find it in Mimico?
That's a good idea.
We'll be more specific.
Okay.
So,
Target.
San Remo Bakery, Jimmy's Coffee, Oak Learners, and Mimico Medical.
You know what? That is an amazing segue. You are getting really good
I'm
at
getting
this
better at
podcast
this.
thing. Joining us in studio, Dr. Timothy Kodsi. He is a physician, and I like the self-described title. It's medical lead at Mimico Medical, a place where you can pick up the magazine, sit down, and relax while you wait for your appointment. See, I'm trying to tie it together.
It is.
Timothy,
Yes.
welcome to the studio.
Thank you. I just want to say people don't wait very long at Mimico Medical, or that's what we're trying to do. So they may have to take it home with them.
Good start,
Yeah.
Doc.
Nice.
I like the sound of that. Because if you are a mom with a kid who's screaming and you don't know what's going on and you've had a long night, to know that you're going to be able to get in there and see a doctor quick is important. Tell us about your history in the neighborhood. It sounds like you've been in the hood for a long time.
Yeah, I grew up here. I came to Etobicoke when I was 5 years old with my folks and grew up off of Royal York there. And it's home. It's where all my friends are, family, gotten to know a lot of the people in the community, a lot of business owners who've been around since I was a kid, and great community there. And I'm just lucky to be back. I really feel fortunate to be back home.
And was that part of the inspiration to start Mimico Medical, that you wanted to stay in the neighborhood, you wanted to be a part of people's lives and part of the community?
I did, and I also wanted to raise my family in the community. So, I have a young son, and, me and my wife always knew we wanted to be in the South Etobicoke area. And when the space next to Castles there became available, it just made sense from a personal standpoint. And it also fulfilled the long-term goal and dream of ending up back home and being a family doctor, something that I think I've probably been talking about with my friends since I was in high school.
That's interesting. So I was going to ask you how far back your inspiration to get into medicine was, because Roger, are you a doctor and I didn't know about it?
No, I'm like the furthest thing from a doctor.
Me too. And so I'm often, it's with reverence that I look at doctors thinking, wow, you went through this process, and the other side of it can be incredibly rewarding and alongside that really, really challenging.
Yes.
So it's remarkable to me that it's all the way back in high school, but you have to have that kind of vision, I think, to get into medicine.
Yeah, it's part of its vision, but I also give, my dad a lot of credit. He was a physician, and, he never forced it upon me and my sister. My sister's also a pediatrician. She's a few years younger. But he just kind of convinced us, we'd be growing up, and he'd take us on a long 40-day backpacking trip in Europe. And on that trip, he'd look at us and say, one of the reasons I'm able to do this is because I'm a physician. And, the other 11 months of the year, I'm working really hard and I'm coming home late and, not spending as much time with you guys and being as involved as, other parents. But, we're able to go and have this amazing adventure together. And, it's something that's stuck with us our whole lives. We look back and we're so appreciative that he gave us those experiences. And he would also just, explain how much, fulfillment he got from his career, how he really felt he was helping people. And he also gave a lot of credit to the Canadian healthcare system, that there's no exchange of funds or any bartering or anything. It's covered. So patients come in and you never have to really have that conversation about who's paying for it. And so he always, really appreciated that about our healthcare system. And not only did he convince me to be a physician, but he convinced me that even though I trained in the States, that one day I should come back home and practice here in Canada as opposed to south of the border.
Where did you go to school?
I went to St. George's University for 4 years, so that's a medical school in Grenada, and then I did my residency at the University of Florida for 3 years. So I wrapped up in 2015.
And you love Canada so much, and the weather didn't dissuade you from coming home.
Well, you gotta.
Both of those locations might have had me settle forever.
There's
you
a such thing as too hot as well. Yeah, remember that.
That in Florida in the summer, right?
Yeah, especially we north central Gainesville, Florida. That's where the University of Florida is. So sorry about that. I messed up there. Yeah, apparently it's the first time someone's ever messed up on your podcast.
That's the first time
Ever.
Yeah, I wanted to point that out. He didn't mess up. I just moved the mic closer to him.
Sorry.
But just before the podcast, I said, nobody ever messes up on this podcast but me.
I mess up.
You have yet
Sometimes.
to mess up. There's no messing up in podcasting. It's just fun.
It's getting too relaxed there.
But it's good. I'm glad to hear that. It's interesting to me that you've had this sort of world experience as well, which is nice because you have a perspective on how important and how special it is that we get healthcare the way we do in Canada. Compared to many places in the world, it is a miracle, actually.
Yeah, we're pretty lucky.
Yeah,
We're lucky. I mean, here we treat people based on the need or the urgency. It's something we call triaging. So, a patient comes in and the first thing the nurse is trying to do or the front line, they're trying to assess the severity of the situation. How quickly do they need to go get this test or be seen by a physician to ensure their safety? In the States, there's a lot more that you need to consider. Who's insured, who's not insured, who's on Medicare, who's on Medicaid. So it definitely simplifies things when you know that you can take them into an exam room and take care of their issue.
Boy, I take that for granted. Do I ever take that for granted? Well, you just said that. Wow, you've got to clear your credit. You have to be.
Oh gosh.
You have to have somebody in administration say, yeah, it's okay to treat this person. In Canada, that's not even a consideration. The patient's condition is the first consideration.
Very lucky. They say there's a triad when it comes to any healthcare system. There's quality, universality, and cost, and cost efficiency.
Right.
And you can have two of the three. But I don't think there's any healthcare system in the world that has all three.
Has all of them.
So we give up a little bit on the quality and access to care. But because our system's designed on assessing based on urgency, yeah, you got to wait a long time for that knee replacement. But if you're having a heart attack and you need a 4-vessel bypass surgery,
you're going to get
it that night.
Right.
So
Right.
Makes sense to me.
Okay, we're going to come back to talking a little bit about the medical center because, as I pointed out, getting a good family physician is really important, especially if you're a young family, and it becomes increasingly difficult, I think, in people's minds. So we'll talk a bit about that. But Roger, you and I have talked a little bit about the coronavirus and the impact that it's had on people's psyche and business and. It is a terrifying bit of business, but as long as we have a physician in the room, do you mind if we do a little bit of Q&A on that?
Yeah, sure. You guys can ask me. I have to just start by disclosing that, I'm not an expert in the field, and this is new to all of us. And I have done some reading and kind of have some idea of what's going on, but then again, we can't really predict the future either. Yeah. So just with, discretion there, but I'm happy to entertain any questions you guys have.
You just answered my first question. How much do we know, even as medical physicians, about this virus? Where does it stand in your mind? What do we know everything we're going to know about this at this moment, or is there a huge, vast divide between here and what we need to know?
Yeah, I think, we're lacking in terms of, what we term epidemiology. So, what's the prevalence rate? How quickly are people contracting it? What's the death rate? What kind of people does it affect more? But we're starting to get answers there. And we know it's a coronavirus. So that's a species of viruses that's very common. There are probably thousands of them out there. Some of them, they'll cause the common cold. I'm sure most people have had a coronavirus at some point in their life. In fact, I can, just go ahead and say that they have. This one's a specific virus that apparently is coming out of China. It's affecting people, and it's gone to a what we call a pandemic rate, which means it's spread out all around the world, which doesn't necessarily mean that it's infecting a lot of people in those places, and then we'd call that more of an epidemic. So you could say Wuhan itself as a city or the province of Hubei have an epidemic, but in terms of it globally, it's a pandemic. And it seems like there's a bit of a higher death rate going on in Italy for whatever reason. I'm not sure people really know, but we're still kind of learning about how it's transmitted. One thing I think we're starting to figure out is the difference between whether it's a droplet or an airborne. So droplet infection is passed on by someone sneezing or coughing near you, or you're shaking your hands, or you turning a knob and then wiping your mouth or your nose. Whereas airborne, the virus can actually live and migrate however many feet across a room.
Right.
And so that's when viruses get scary. When they're airborne.
Which is it, Doc?
We're starting to lean more towards droplet, right?
Okay.
But that's one reason why we fear measles so much, is because measles is airborne, so it's
Right.
much more highly contagious. We also know that people who are healthy and don't have a lot of other diseases and are relatively young aren't really at risk of dying from COVID-19. We're seeing a lot of the deaths tend to be in people who have, an immunocompromised system, or are ill with other serious illnesses, or are elderly. So, the answer is we don't know. We don't know how serious this is going to get. I definitely think the economic impact is largely psychologically based. And I think that's because of a lot of that has to do with the uncertainty regarding the virus and how serious this is really going to become. So from a health perspective, it's, wash your hands, cover your mouth. If you know somebody who's traveled to, one of the epidemic areas and is coming back and they have a fever and a cough and shortness of breath, stay away from them and, just stay calm.
It just seems to me that there's a lot of, there is a media fervor about this. And I don't think that we're not going to put this in the description of the podcast, because that'll get downloads.
Yeah.
Don't kid yourself.
Yeah.
But there is
You'll probably want to add that buzzword somehow.
Yeah. It's amazing that becomes the case, and it gets us into a panic state. But like many viruses that we've heard about before, from SARS to whatever, it really does target a certain age demographic who, by and large, from what we understand, is not necessarily going to be able to fight off the virus in the first place. Most of us would be able to.
Yeah, and it's not just with COVID-19. I mean, if you had a patient who was susceptible and they got any kind of coronavirus, including the ones that cause your run-of-the-mill bronchitis or common cold, they might not make it either. So again, there's still a lot of information out there that we need to figure out. We need to collect data. You can't collect data until the disease actually presents itself and affects enough people.
Okay.
So, I think people tend to jump to conclusions, and we need to kind of stick to the scientific method here and come up with real answers. And in the meantime, we need to be diligent but calm. And that's, what I'm telling most of my patients. And if they come in asking me for travel recommendations, I say I really can't, recommend if you should go to Spain in May or not, because we don't know what Spain is going to be like in May, and we don't know what this epidemic or pandemic is going to be like in May. So
that is a big consideration, isn't it? I mean, with the summer on the way, even March break shut down a little bit, I think. I know 2 or 3 people that have canceled March break vacation.
Really?
Oh, yeah.
Oh, wow.
And they didn't. It wasn't a light consideration. It's an expensive thing to cancel a trip. So.
Well, that's really where you worry about the economic impact,
right,
and the way it's going to affect people's, people in other ways.
Man, I really like talking to you.
I like talking to you too, man.
This is a great way for people to understand who they're meeting at your clinic, because you're a real straightforward, lovely guy to chat with. And you've made a lot of things easy for us to understand just on that topic. So thanks.
I appreciate it. It's my pleasure. Thanks for having me.
Let's talk about the medical clinic. Now,
cool.
What sets you guys apart? I've heard a couple of things from you. One of them is that you're not going to wait a long time.
Well, that's what we're definitely trying to do. I mean, at the end of the day, we are going to fall behind, and it's going to happen. Why? Because we give people their time. So some people, they come in with, really quick issues. Other people, they need our time. You have to remember, we're seeing a lot of people in their most vulnerable states, and we have to pivot, and we have to recognize when a 15-minute appointment needs to turn into a 20 or 25-minute appointment. But I think we're doing a really good job of adapting, managing, coming up with systems, collecting data, understanding where we can improve our workflows. We're working on a very comprehensive manual, clinical practice guide manual for employees and physicians, so that we have a great triaging system in place. But these things don't happen overnight. It's a constant development. And, again, we're a young team, and we're also homegrown too. So Tara, our physiotherapist, we've known each other since we were 14 years old. And we would talk about this when we were in our college years about, getting together and opening a clinic together and working together. And, she's right next to me there in her physio gym. My office is in the back there. And, it's surreal. Every day I go to work, it's surreal that I have Tara right there. And you know what? She also...
I bet it is.
She believed in me too. She was the first one to jump on board when the clinic didn't have any lease improvements. It was an empty space. I remember, a couple days after I signed the lease agreement, we met there one morning. She just said, I'm in. She just looked at me with that trust and said, I'm in. And now we've been lucky to bring on Lisa. She's our patient advocate and director of operations. And she's also someone who's been in our circle growing up. She's extremely talented.
Patient advocate.
Yeah.
What an amazing thing to have in your corner.
We need to.
Yeah. My patient from our clinic needs this. I need to look out for them, that this test is complete, that they're getting this attention elsewhere, that they're back here, that they're being looked after by somebody who's not just their physician. It's being organized by somebody who cares for their...
And that's one thing, one big part of what she does. But she also, really, when I was talking about, all the ways we're collecting data and coming up with systems and improving our staffing. And, she's really the what's driving the machine at this point.
Fantastic.
So we're lucky to have her. And, even our staff members that we've met over the years, months, we're about 16 months old. We've also found that locals, people who grew up in the area who understand the Mimico culture are doing really well for us. So, our front office staff now, Casey and Stephanie, they're both local. They've both been in the area a long time. One of them actually, grew up in the area and went to the same high school as Tara and Lisa. So, we feel like we're homegrown.
It's amazing.
Yeah, I wanted to jump in on that. So I'm going to be publishing an All About Mimico edition for April. You guys are going to be on the cover. You mentioned the Mimico culture. Can you talk a bit about what that is?
Well, sure. Let's talk about Toronto, first of all, and the way the city was built. It was built from the lake up. So the oldest houses we have are down by the lake, and they get newer and newer as you go more and more north. At least that's how it is in Etobicoke. So you got to remember, Mimico's been around a long time, and any township, which is what I would call it, that's been around that long, develops its own culture. And, I think it's a culture that's based on mutual respect and being straightforward and not beating around the bush, and but also treating people kindly and with a smile on your face and making eye contact and being genuine. And I think that's what we get as providers over there at Mimico Medical is, there's no patriarchy here. We're a team. I'm going to treat you the same way. If you're the richest guy in the neighborhood or the guy who's panhandling outside the coffee shop, it doesn't matter to me. I'm going to treat you the same.
I love that. I spent a long time trying to put my thumb on the pulse of the Lakeshore community and trying to understand why it's different here than it is in Toronto. And I think you really kind of hit the nail on the head.
I was going to say, I think that defines it nicely.
Fantastic explanation. Thank you.
And it is something. Now, I'm an outsider. You guys let me in every day. That's really nice. I pass through the gates into Mimico, and there are no gates, by the way. They're in my mind. But I definitely have noticed that this is a really warm community, and to have that so close to and as frankly as part of a metropolis, it's a rarity. It's something that this community needs to cling to, and that people like Dr. Timothy over here are making great strides in keeping happening. So I commend you, and congratulations on the practice.
Oh, thank you. I feel blessed. I feel like no congratulations is in order. I go to work every day. I feel very lucky.
Well, that's you know what they say, Roger. You and I have that same blessed day where we every day it's a lot of fun to do because we're passionate about it. I noticed that about all of your guests. Actually, they love what they do, so that's a big thing.
I was going to ask you what gets you up in the morning, but I think I might know the answer to that.
Well, it wasn't always like that, right? This is only the last 16 months getting set up back home here, and but it was, you alluded to it earlier. It wasn't an easy road to get here. It was, 10 years of a lot of sweat equity, a lot of indebtedness, and not just to the banks, but also to the people around me and the people who supported me. It was a lot of my family and my wife. And it took place during the formative years of my son's infancy. So it wasn't easy. But now that I'm here, I really do feel blessed. So, that's what gets me up in the morning is I look back at how it used to be, and I see what my life is like now. And I just say, you know what, I have nothing to complain about. And I feel so lucky every day that I wake up.
Yeah, that's beautiful. That's really great.
You know what? It's nice to have a guy in the neighborhood who feels this way about his practice, his business, and the community. Well, it's home.
Yeah, and I was going to say, I don't think people go into the medical field without a desire to help others, but I think you take it one step further.
Yeah.
You certainly have a passion for your profession, but also for your community.
I do. I am very passionate about both of those things. And I think when you put them together, that's what makes me feel so blessed. But I also wish people knew more about what we had to deal with on the day-to-day and what our days are really like, because I think there's also a misperception out there that, we're spoiled, or that we don't work hard, or that, we don't work long hours, which I think is really a misconception. And I think also people don't realize the sacrifice we make during our years of training and how gruesome and brutal it really does get.
I can't fathom it. I really can't even imagine that many years of school. And then...
And debt.
Yeah. And then you come out the other side, and people are like, ooh, doctors, they get this and this. No, doctors have to be within guidelines that are almost impossible to operate in at times. So,
well, I'm smiling over here because I feel like maybe we're stumbling upon a potential monthly column in the magazine.
Hey, I would love to be
a
involved.
little bit of a life behind the scenes.
Oh, no, you don't. We want them for the podcast.
I'm going to tell you something. Something else I always have had a big passion for is reading and writing. So, all those years I was in med school, I made sure that I didn't just read about medicine. I read about a lot of other things, and I'd love to, show off. Not show off. That's a terrible thing to say. I'd love to contribute to your magazine and put some of those skills I've developed to the test.
Hey, there's nothing wrong with showing off.
I don't want to show off.
It's exactly what I'm doing with my scalp right now. Just showing it off. I'm not bald.
Nice scalp.
Thank you so much. And that's a doctor's opinion right there.
That's right.
Follow along and find your new doctor, by the way, at mimicomedical.com, Mimico Medical on socials. And it's been a delight having you in. Thanks so much.
Thanks a lot, guys. I really appreciate the opportunity.
And I'm going to tell you this as we wrap. Don't forget to subscribe to the podcast. Don't forget to pick up your edition of the magazine. It's out and it's beautiful. On the cover of this month's magazine, you'll find our good friend Amanda Kirkland, the owner of Blue Concierge. And, of course, you can go to etobicoke-lakeshorepress.com and see the online version.
That's right. And look out for our April edition featuring Dr. Kodsi and the staff of Mimico Medical.
You are my friend with the publication, Roger. Thank you.
Thank you.